what did you do, and what advice would you give someone who's had the surgery or treatment? Again, surgery is still prevalent here. So
yeah.
I guess we would try to, make sure that they were taking their medications, they were alternating with the appropriate medications. I feel like by the time we saw them, once they were discharged from the hospital, they were uncomfortable, but in some ways they had learned to live with that uncomfortability as well. And when things got bad or worse, they weren't shy about saying so. And if they were still on their regime of, like, I don't know, Tylenol and Dilaudid around the clock, and that wasn't working anymore, we would, just communicate to the team that, okay, we need to do something because this isn't working. We would look for other signs of things going on too. Like, was the wound site infected? Was it, all these things that we would look for. Like, are they, I don't know what else it would be at that time, but I think we just would get the whole group together so everybody could think about what was, what could we do?
Yeah. And another thing that's just so vital is the positive, being positive thinking and positive, encouraging people to, continue on the path, just, you're going to have a bad day. You're going to accept it. You're going to have a bad day. You got to say, okay, tomorrow will be better. And, just kind of constant, positive reinforcement.